Kuri na mwihoko kuri atumia aria manarutwo nyondo ni undu wa murimu wa kansa ya nyondo, kona thibitari wa Kenyatta University uri na urigitani wa mwanya wa gucokia nyondo kuri Arwaru aya, makiuga ni maheanite urigitani uyu kuri atumia mirongo itano gukinyaniria riu. Kuringana na John Paul Ogalo, uria ni ndagitari thibitari-ini uyu, augite marihi ma urigitani uyu ni marugamirire ni mutaratara wa marihi ma thibitari wa SHA na ni wa gatagati ka 112 na 168.
We've done our own local data in terms of breast reconstruction, and what we found that was about anywhere between 5 to 10% of the patients who have their breasts removed because of breast cancer end up getting a reconstruction.
Anthony Kamawuria ni murugamiriri wa arigitani thibitari-ini uyu, augite urigitani uyu ndwarugamagirirwo ni mutaratara o wothe wa marihi hau kabere ta uria uri kwa ihinda riri, riu akiuria atumia aria marutitwo nyondo ni undu wa murimu wa kansa meyumirie gucokerio riri wao.
Ni tu welcome mutumia tocio handu fulani urathikiriria na maybe ni uhitukire surgery ukarutwo breast yaku, ni tu welcome uku tu surgery reconstruction. Ega wa reconstruction ino kana gucokio kiumbe ni ukavitwo ni SHA.
Anyitite matiganite ni manyitite miario eno baru makiuria muingi wetikire guthimwo murimu wa kansa kuona ungimenyekana tene ni urigitagwo na kurigiririo.
I was surprised because of the high level of the surgery here for breast cancer. I think, as Dr. Van Leken said before, that probably the limits here are not the professionals. The limit here to have an early diagnosis of cancer.
Haduini ha Kameme TV, ritwa riakwa ni Nduta wa Buthia.